Good afternoon, and thank you for joining us. I'm Michelle Carroll, founder and principal consultant of LexCura Summit Medical Legal Consulting. Today, we'll explore how artificial intelligence is reshaping the worlds of medicine, law, and compliance, three domains that have traditionally operated in separate lanes. Over the next 40 minutes, we'll uncover what AI means for hospitals, for healthcare attorneys, and for consulting professionals who navigate both. We'll also look at where LexCura Summit believes this convergence is heading. Let's start by grounding ourselves in the current landscape. Hospitals face unprecedented administrative load. A single patient encounter can generate hundreds of data points and documents. Attorneys supporting these systems wrestle with new liability questions, documentation accuracy, data security, consent tracking. And consultants like LexCura Summit are often the interpreters, translating between the language of clinical care, regulatory code, and business strategy. The shared problem? Everyone is overwhelmed by information. Artificial intelligence doesn't eliminate that burden, it helps us manage it intelligently. With that context, let's look at how quickly this change is accelerating. Across industries, AI has shifted from experiment to expectation. Hospitals use it to read radiology images. Law firms deploy it to scan millions of discovery documents in seconds. Analysts forecast that healthcare oriented AI will surpass $200 billion in value by 2030. Legal and compliance, AI, are tracking similar curves. The critical insight is that AI is not replacing professional judgment, it's augmenting it. At LexCura Summit, we view AI as a new layer of professional intelligence, one that multiplies human capability rather than substitutes for it. Let's break that down by sector, starting with hospitals. Within hospital systems, AI is already detecting patterns humans might overlook. Predictive models flag high risk readmissions days in advance. Diagnostic tools highlight anomalies in imaging. Automation ensures documentation meets coding and privacy standards. Picture a nurse manager reviewing an AI generated staffing forecast that balances workload, patient acuity, and regulatory requirements. That's efficiency coupled with safety. Yet every automation introduces new accountability questions. Who validates the algorithm and who owns an AI's clinical suggestion? These are the kinds of questions LexCura Summit helps administrators anticipate before technology is deployed. And as hospitals adapt, the legal community must evolve alongside them. Attorneys are finding AI indispensable for evidence management. Automated systems can flag inconsistent records, track metadata, and even predict case outcomes based on precedent libraries. But this convenience demands vigilance. If a model's reasoning isn't transparent, can its conclusions stand in court? LexCura Summit encourages counsel to treat AI outputs as advisory, not determinative, much like expert testimony. When legal teams understand both the capabilities and the limitations, AI becomes an ally in risk reduction rather than a liability. Now, let's examine what this means for consultants operating in both worlds. Medical legal consultants historically spent hours consolidating medical charts, interpreting terminology, and aligning timelines. AI now performs much of that groundwork, extracting key phrases, correlating symptoms with standards of care, and flagging documentation gaps. This frees consultants to focus on interpretation and strategy. LexCura Summit has integrated AI review protocols into its internal workflows, enabling our experts to deliver faster and deeper insights while preserving confidentiality and accuracy. The consultant of the future is not replaced by AI, they are amplified by it. Still, amplification must come with ethics and guardrails. Artificial intelligence systems learn from data, but data can reflect human bias. If those biases remain unchecked, predictive tools may reinforce disparities in care or access to justice. Privacy and consent also evolve. Patients may authorize data use for treatment, but not necessarily for algorithmic training. LexCura Summit advocates a responsible AI framework where validation, documentation, and ethical oversight are integral to every project. This alignment ensures that innovation never outruns integrity. And nowhere is that alignment more critical than in compliance. Compliance used to be reactive, responding after an incident occurred. AI shifts it forward. Algorithms can watch for anomalies in billing, documentation, or consent patterns, alerting compliance officers before violations happen. This transforms compliance from cost center to strategic safeguard. LexCura Summit collaborates with healthcare entities to design these feedback systems, balancing vigilance with privacy, automation with human judgment. So, if hospitals and attorneys are investing, what exactly excites the investors themselves? Investors are chasing the convergence. They're not just funding clinical tools, they're backing platforms that combine care optimization with defensible compliance. From predictive analytics to automated documentation review, cross-sector partnerships are drawing billions in new funding. LexCura Summit positions itself within this current, serving as a trusted interpreter for investors seeking clarity in a complex regulatory landscape. And as money moves in, hospitals are re-architecting their systems for what comes next. Tomorrow's hospitals will look less like buildings and more like networks. Artificial intelligence engines will connect departments, outpatient clinics, and remote monitoring into continuous learning systems. Leadership will need cross disciplinary governance boards, clinicians, attorneys, technologists to oversee data policy and ethics. LexCura Summit's strategic insight helps boards frame these governance models before regulatory mandates catch up, and similar change is underway in legal and compliance firms. Legal firms are becoming data companies. They're building digital case platforms where AI identifies precedent relevance and outcome probability. Compliance consultancies mirror this shift with automated evidence logs and intelligent audit matrices. For LexCura Summit, this convergence underscores our mission to translate the technical into the defensible, to make AI innovation legally sustainable. Which brings us to LexCura Summit's own role in this evolving ecosystem. At LexCura Summit, we occupy a rare intersection. Our consultants speak both medical and legal dialects, enabling organizations to integrate AI with foresight and compliance. We design frameworks where emerging technology complements professional ethics. This isn't about selling software, it's about shaping standards that safeguard patients, clients, and practitioners alike. So, what future are we building toward? LexCura Summit's vision is to embed intelligence into every phase of consultation. Imagine compliance reports that self update as regulations change, or case triage tools that predict documentation risk levels before submission. These capabilities are within reach. Our focus remains on transparency, verifiability, and security, principles that turn innovation into trust. And with that, let's consider the broader opportunity this transformation represents. The AI revolution in healthcare and law will reward collaboration over competition. Hospitals, firms, and consultants who share secure data will identify risks earlier and deliver fairer outcomes. The opportunity isn't just financial, it's moral and operational. It's the chance to build systems that are both efficient and equitable. LexCura Summit intends to be a compass for that transformation. Let's close with what this means for all of us moving forward. Artificial intelligence is no longer tomorrow's concept, it's today's responsibility. The choices we make now will determine whether technology enhances or erodes trust in medicine and law. LexCura Summit stands committed to ensuring it enhances it through guidance, compliance design, and principled innovation. Thank you for joining us. We invite you to continue the dialogue. Reach out to our team at info@lexcurasummit.com to explore collaboration or advisory opportunities. Together, we can build a future that is not just intelligent, but ethical, secure, and human.